If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how mini dental implants will change your life.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
The constant adjustments, it seemed like I was back at my dentist every other week to adjust this and adjust that.
I couldn't eat almost anything.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the mini dental implants was a life changer for me.
It's more affordable.
Very affordable. It's well worth it.
There was no pain.
What pain?
I can eat everything. It's unbelievable.
I don't have to put all the goo on.
With these, I can eat everything.
Now I can smile and show the world.
I don't have to worry about being embarrassed going to a restaurant.
It's the best decision I ever made.
It gave me the confidence to have my smile back.
It hasn't made my life easier, it sure has.
The mini implants are the only way to go.
It's been fantastic.
It was life-changing.
I don't know what else to say except it was almost a miracle.
It's just so much better.
I'm happy. I'm very happy.
It literally changed my life.
My dental implant has changed my life.
I'm excited to be me again.
I feel like me again.
It'll be the best, smartest move you ever made.
I love it.
It's incredible. It is. It's absolutely incredible.
Hello, everybody, and welcome to Innovations in Health. I'm John DeSciullo, welcoming Dr. Ronald Davis from Greenery Park Dentistry, a mini dental implant center of America. And that's what we're talking about, the mini dental implant. It's a procedure that will change your life, where you can be you again. Imagine here in the great state of Montana, biting into that steak, enjoying the foods that we love so much. You can do that. Mini dental implants, they're 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. Welcome to the show.
Thanks, John. It's good to be here.
Yeah, great to have you here. And we're talking about the mini dental implants, and the model you have in front of you is really an example of a conventional implant, and you can show the difference between the old and the new.
Yes, John. You can see here that this hole is the traditional implant uses a hole like this. The mini dental implant uses one that's usually way less than half the size of the full-size implant.
Yeah, look at the difference in that hole.
It's huge, yes.
Yeah. And so the conventional implants would also take more time because of the way the bone had to heal and the way the patient had to wait months in advance,
yes,
before they
because of the size of the hole, you have to put the implant in, let it sit there around 3 or 4 months, and then you can start to restore it. With the mini implant, we can put that in, and many times we can do the restoration the same day.
Same day, so from a few months to 1 day, and in-office procedure as well.
Absolutely, local anesthetic is all that we need, very little discomfort. It's a great procedure.
And if you want to know exactly what the mini dental implant can do, if you're wearing dentures, then pay attention, because if you have a lower denture, for example, and you're used to having it swim around, the mini dental implant will stabilize this.
It certainly will, John. You can see here, when we do a mini dental implant case on a lower, we put in 4 implants. Then you've got your denture here that has some housings inside it that have little O-rings in them. And those housings will actually snap over the denture, make it very difficult to get that off.
And one of the things, Dr. Davis, that I think is really important in talking about this, most people with the dentures are used to having that goop. And that goop, you swallow it, it's not good for your digestive system. The goop is gone with the mini dental implant.
Absolutely, that stuff tastes terrible. It's hard to get out of the denture, hard to get off the gum tissue, and it doesn't work all that well.
Yeah.
With the mini dental implants, no more goop.
Stabilized, and the confidence level comes back. The next example you have is an upper, which brings back the sense of taste.
Absolutely. With the upper, see, I had a hard time getting that off. With an upper, we use 6 implants, and that lets us take what used to be this palate here. That used to all be filled in with acrylic. Now there's nothing there. Your tongue can get up there, you can taste it, you can feel hot and cold things with your palate. It's much more comfortable, and it's certainly more stable.
And here it is, the new age, and yet some people are just resigning themselves to the fact, well, I have a denture and that's just the way it's going to be. But no, that gag reflex, particularly with the upper, is
absolutely
awful.
That just goes away. There is no gag reflex.
I mean, really, truly, imagine digging in. We love our food here in Montana, and now you can enjoy it with great gusto without fear that your teeth are going to come out.
I had a lot of difficulty in eating.
I couldn't eat 3/4 of the food that I enjoyed eating because I couldn't bite down on anything.
I couldn't eat almost anything.
But with these, I can eat everything.
I can eat everything. It's unbelievable.
It was done, over, done. Go home and eat.
I can eat steak, I can eat sandwiches.
I had dinner 45 minutes later.
I can chew a steak. I could not do that before.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
It's made a tremendous difference.
Best thing I ever did. I mean it.
I love it. It's life-changing.
I can eat anything I want. I'll smile at anybody, you know. It's outstanding. I'm happy. I'm very happy.
I'm very, very pleased that I have them now.
So we just looked at dentures and an upper and a lower and how the mini dental implant can stabilize, but there's another level and it's called the fixed on 6, and you have an example.
I sure do. With the fixed on 6, it has a couple of advantages. We usually use 6 or 8 implants. The restoration doesn't have any plastic on it, and it's made out of a material called zirconium, which is very hard and very durable.
So just like the real natural teeth, the zirconia is, takes a licking and keeps on ticking, like they used to say. Yeah.
We have the same housings inside, just like a denture does. And the beauty of this is the patient doesn't ever take it out. So for the patient, it's pretty permanent. When you come in for your cleanings twice a year, we'll take it out and we'll clean the housings and we'll make sure the O-rings are in good shape and we'll clean your implants and then we'll put it back in for you and you don't have to worry about it for 6 months.
And look how good that looks, everybody. That is
They look fantastic.
It's a fantastic.
It's a great restoration.
Yeah, and not only the confidence level, but the look from a cosmetic perspective and from a realistic perspective, enjoying the food that you like and just having all of that life moments back. But, friends, if you had your baby teeth and then your adult teeth, Dr. Ron Davis from Greenery Park Dentistry is going to give us our 3rd set of teeth. This is an even bigger mini dental implant experience.
This is really beautiful. This is called a roundhouse bridge. We'll typically put 10 to 12 implants in. And then this bridge, instead of having housings in it, just sits right over the implants and we cement that in place so it does not come out.
That's a real permanent
That is
situation.
a permanent solution, just like having real teeth again.
Yeah, and we talked about the care that a mini dental implant needs, certainly going back to the dentist from time to time, going to see you at Greenery Park Dentistry, and a water pick will keep them clean.
The water pick does a marvelous job of keeping these clean.
Yeah. So imagine now, if someone needs this kind of work, if they have some teeth that are not really that strong, you would extract them and then this would be their new set.
Yes, that's correct.
That's great. And here in Montana, some people go out, they hike, they go out, they fish, they might have an accident, they might knock a tooth out no matter what your age. And you have an example of a mini dental implant and a story to tell too, particularly about a single tooth.
I do. In this situation, we had a patient who's 82 years old. She has some memory issues. Well, she had a fall and actually lost one of her lower front teeth. And she wasn't a good candidate for removable partial because she would probably lose it. So instead, we took her tooth out, put a mini dental implant in, and were able to put a crown on that day.
That's amazing. And look at that. And this is a custom-made tooth for the patient. This isn't something that you just order in a box and then insert.
No, this is not a crown in a box. This is a tooth for a patient.
And the teeth that you have on the side, very important because, if something's out of sight and out of mind, you might think, well, it's not worthy of my attention. But it's very important because the teeth in the back of the mouth shape the contour of your face and are so important for the chewing and the digestion of food. And the mini dental implant can really make the partial go away because now you've got an opportunity to fix what's in the back.
Absolutely. We can give you back your ability to really chew your food well. And we know that people who are able to eat well as they age do age better.
Yeah, they feel better.
Yes.
Yeah. So show us how that works.
Well, in this case, the teeth are missing or we need to take them out. We'll put in some mini implants and then we have a bridge that we'll put in, just cements right over those, and that again is a permanent restoration.
That looks terrific. And again, custom made for the patient.
Absolutely.
And these folks, these products are made in America. We should mention that. And the titanium post that we talked about is sort of like the post, and then the implant affixes to it, and the bone will grow underneath. It's called osseointegration. I learned that. And that way it becomes a real permanent situation.
It does. That implant will become part of your jawbone, and those teeth will function very well for you.
You talked about a senior that had some work done, but a mini dental implant could be done with someone of any age.
Oh yeah, we had a woman in her mid-30s who was from birth missing an upper lateral incisor, and she had a bridge done when she was younger and it was all discolored and not looking good. So she thought she'd go to an oral surgeon and find out about having an implant placed. And they took a look and said, gosh, you don't have enough bone for an implant. So she came to see us and we were able to take out her old bridge and put a mini implant with a crown on it in one appointment again.
Wow.
And she was thrilled.
Yeah, it really changes your life. You can be you again with the mini dental implant. If you're just joining us or you've been watching us for the full run here, we're going to have more information because you need to write down this information. Dr. Ronald Davis is from the Mini Dental Implant Center of America at Greenery Park Dentistry. They're at 44 Mile Drive, Suite 6, right here in Kalispell in the great state of Montana. Here's the website, greeneryparkdentistry.com, and the phone number, and it's on the screen so you can write it down, 406-420-3636. And you'll want to write that down because I know you'll want to call Dr. Davis and his team, and you have a great team in place there.
We do. We have a marvelous team. They take great care of our patients.
Yeah, and so let's get to know you a little bit, Doc. Where are you from?
Well, I'm originally from Wichita, Kansas, and I practiced in Wichita for 21 years, and we came to Montana to visit my wife's sister, and 3 years later we lived here.
See, it's the lure of Montana.
Absolutely.
It's so idyllic here.
Absolutely. It's a great place to live.
And you had a connection to Colorado. I believe that's where you got your dental education.
Yes, I went to dental school in Colorado, and we thought we would move back there until we came to Montana.
Yeah.
And that was it.
What is it about Montana and the patients that you serve that makes it so special?
Well, the people in Montana are great. When we moved, I was welcomed with open arms from the people in Kalispell, from my colleagues. They're down to earth. Montanans are pretty straight shooters. They tell it like it is. And it's been a lot of fun to get to know a lot of great people.
Yeah. So Dr. Davis, from really Flathead Lake to Glacier National Park, people can come to see you and get their lives changed with the mini dental implant at Greenery Park Dentistry. It's a wide swath of the state that you serve.
It sure is, John.
It's really Missoula to the Canadian and Idaho border.
Yes.
And I should mention too, you're very humble, but you have a reputation for providing pain-free dentistry. I know that is very important to you.
That's really important. I think that modern dentistry should not hurt people. And it's our goal in our practice to make our patients as comfortable as we can.
Yeah.
We think we're pretty good at it.
Because I think a lot of people, their fear of the dentist from years and years ago is based on pain.
Yes, we see that every day. People coming in who are still, they have that experience when they're young, and it's very difficult for them to walk in our door.
How long have you been in practice?
I've been in practice a total of 33 years. The last 13 of that are in Montana.
Yeah, so you've been around a while to practice dentistry, but you keep up on the technology, which is very important.
Yes, we do. That's been a focus of ours all along, is trying to really stay current, know what the best practices are, and provide really good up-to-date care for our patients.
Yeah, and your wife's here, your family's here.
Yes,
yeah.
We have our 2 children followed us out here, so we feel very fortunate to have them close.
Yeah, and I know even though you love practicing in Montana, I know you fly across the country to Buffalo, New York, and you've met Dr. Todd Shatkin, who has really become an innovator. He is the innovator in health when it comes to mini dental implants. Talk to us about that connection, because as we said, you've been in practice a while, but you got to keep up on the technology.
Yeah, and I learned about Dr. Shatkin after doing some research, looking for somebody to teach me and help me learn how to do mini dental implants, because I could see it was a great benefit to our patients. So I went out to Buffalo to see Dr. Todd, and took his first course, and then I came back a few years later and did it again, and then we've decided to go to the next level, becoming a dental implant center.
Yeah, so you are a Mini Dental Implant Center of America right here in Montana, address 44 Mile Drive. What are you near?
Oh, we're very near the community college in Montana. We're also very near kids sports ball fields. They do soccer and football and baseball and softball, and it's a really nice facility that we have, and I think everybody pretty much knows where kids sport is.
Yeah, and a lot of people come to the Kalispell because there's a medical facility there, and so they're coming for all kinds of other treatment as well, and now your treatment with the mini dental implant could be included in that.
Yes. Kalispell Regional has really grown, and they offer a lot of different services, so many people come to town for that.
So Flathead Valley from the Idaho border, right, really all the way to the Canadian border, you know, people are available to come to you.
Yes.
You have your website, and it's greeneryparkdentistry.com, and I know you do other kinds of dentistry as well, so it's not just the mini dental implant. So if somebody is out there and they need to go to the dentist, or they've been putting it off for a while, you should go and see you and the team.
Yeah, we really do a pretty wide range of dentistry, cosmetic dentistry. I really enjoy treating people that have TMJ problems or jaw joints hurt, they have headaches, and we're able, for the vast majority of those people, to really help them get some relief.
Yeah, you talked about balancing the bite when it comes to TMJ. What does that mean?
Well, for most people, if they're having pain caused by their jaw joints, usually their teeth aren't hitting just how they should. They're not contacting just right. So what we try to do is go through a process of analyzing why it's not right, where it's wrong, and making it right for them. And for most people, that gives them relief.
And that must be a terrible condition to sustain. So if somebody is experiencing TMJ and they come to you, and what a relief that must be. It must be an amazing experience for you to see someone get relief.
That's a lot of fun, is what it is. When we see somebody who's had years of pain, we can provide them with treatment, and they come in a few weeks later and say, I can't believe I feel this good.
Yeah.
That is really great.
You're making a difference. And the mini dental implant, you can be you again. Let's talk about the consultation. It's a free consultation.
Yes.
So if somebody comes to your office at 44 Mile Drive, Suite 6, what do you discuss?
Well, we'll take an x-ray, a complimentary x-ray, and then we'll sit down with them and look at their individual situation, talk with them about what their options are, and help them come to a decision about what's best for them. That's what we want. We want what's best for them.
And so you get to know the patient, and invariably the discussion will lead to price. And
Yes.
you know, as we all know, we pay for our cars on time, we pay for major appliances, our homes. We find a way to do it, and you can find a way at Greenery Park Dentistry to work with the patient to make that work. How do you do that?
Absolutely. We work with 2 or 3 different financing companies, and we try to make it absolutely affordable. We want people to have it done because it's such a benefit to them. The first thing is to help them figure out what they want. The second thing is to help them figure out how they can afford it.
Yeah.
This was really affordable.
Yes, it's totally affordable. It's totally affordable.
I would definitely recommend mini dental implants to everyone.
Very happy with it. It looks natural, it feels natural.
I wish I would have got it done a long time ago.
It's the best decision I ever made, so it's well worth it.
And we should mention, folks, this is an investment in you. If you've been putting off any kind of dental work, you really need to jump in, because it could make a matter that's a little problem, a big problem in a short period of time.
Absolutely. If we catch things early, we can fix them much easier and less expensively.
Yeah, and I think the confidence, we talked a little bit about that when we discussed the dentures, the sense of confidence. And it's not just with your dentures falling out. If maybe someone is going to start a new relationship, or they're looking for a new job, or they've just moved to Montana, you know, from a major urban center, and they want to start life all over again and feel good about themselves. Coming into the situation and not feeling confident about how you look or how you smile can really bring you down. And I'm sure you've met with patients that have said, I can't believe I waited this long.
Sure. Yeah. People cannot believe the difference it makes in their life when we can give them their smile back.
Because you don't want the embarrassment, particularly if you're a senior and you have grandchildren and the teeth fall out, or you take them out and you have to clean them. It seems so Stone Age in so many levels.
Yes, it is. With all the things that we can do for people today with mini dental implants, having a denture that's sloshing around in your mouth is not necessary.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
I feel a lot more confident. My smile feels better.
And it brought a lot of confidence back to me.
After the procedure, wow, yeah, you smile.
It's just unbelievable what it's done to my life.
I feel like I do have more confidence than I did before.
And how many younger patients have you had that would, not only with the mini dental implant, but any kind of restorative dentistry?
Oh, we've done work on people as young as about 3 years old. Not implants, of course,
yeah.
But we have patients who are over 100. So we see a pretty big range in our practice.
Yeah, and I would think they would, at a senior age, say, wow, I can go back to enjoying that great steak again, and I can taste the food that I remembered so well.
Absolutely.
Yeah.
It makes a big difference for them.
And it's important because what goes into your mouth is really the focus of the whole body. The center of your health is all about dental.
Yes, it is.
We talked a little bit about the mini dental implant, and now if you've been watching us for a better part of the show, or you've just joined us, this is a model that I'm going to have Dr. Davis show, because the difference between the conventional implant and a mini dental implant is dramatic.
It sure is. Here we have the conventional dental implant with the large hole and the hard to see hole for the mini dental implant. And because that hole is small, that's why we can thread that implant in and get immediate stability and load it immediately. With a big implant, you're just kind of sitting it down in the hole and you don't get that stability in the bone.
And you need more bone for the conventional implant, and that's why it takes so long.
Yes, you do. You have to let that bone heal around it completely or it'll fail.
And we should mention with the conventional versus the minis, the mini dental implant is 5 times less. It's less invasive, as we just saw, less pain and discomfort. And we're going to talk about that in just a little bit. So if you have a question about the pain and discomfort, stay with us because we're going to talk more about that. Less healing time, less visits to the dentist. Not that you don't want to go see Dr. Ron Davis and his team, but it's less visits. And most importantly, it is less expensive. And those are the keys, I think.
Yes, they are.
And we talked about the lower denture. I believe this is the lower. Take a look at that and show us why it's so important to get the mini dental implant if you have a lower.
Well, I describe a lower denture as being in a canoe in the ocean with no paddle. That's what I tell my patients, because they are just all over the place, up and down on the tongue. When you put those implants in and that denture snaps into place, you have confidence that it's going to stay there and you can chew your food.
And we talked about the fact that if someone has a denture, you'll work with them with their denture, or if they need a new one, you can help create
Absolutely, and that's something in the consultation process. We can evaluate their current denture and see what kind of condition it's in. Is there enough room to put the housings in? If so, we will certainly use their existing denture.
What would be the determining factor for somebody to actually get dentures?
The determining factor would be that their teeth are just in poor condition, and they're either missing a bunch of them, or they're broken, they're decayed, or they've had gum disease and they just can't function with their teeth anymore.
Yeah. So if that is the case and someone has to have a denture, it isn't sort of you're not being penalized anymore. I mean, you can get the denture, but the fact that it's stabilized makes this such an easy process.
Absolutely, it's very comfortable for the patient.
Yeah, it's a comfortable situation. And when we looked at the upper, show us how that palate is exposed, because this is something, before I started to do this program, I never realized how important the palate is for the sense of taste. I mean, that's where it all happens.
Sure, well, you can see right here, all that used to be acrylic, and now it's not. It's a place for your tongue to go.
Yeah.
And you can taste your food, you can feel the texture of your food a lot better.
So on a denture that has the plastic, it's sort of like a suction that keeps it into place.
Yeah, you have to have that palate to have suction to keep the denture in place. When you put the implants in, you don't need the suction anymore.
And then that sense of taste comes back. The patients that have had the mini dental implant, they must tell you, oh my gosh, Dr. Davis, I can enjoy the sense of hot and the sense of cold again.
Absolutely. That, and I can taste my food better.
Yeah.
So
is that one of the reasons that people ultimately want to get a mini dental implant?
I think that's one of the reasons. I think the overall stability and just ability to chew.
Yeah.
And it's really nice to have that palate open. Some people cannot wear their upper denture because of the palate.
Interesting. Why do you think people put off either talking about the mini dental implant or getting some other action taken? Is it just because they figure they're just resigning themselves to the fact that they have dentures and that's how it has to be?
I think some people are. I think there's a lot of people that don't know about it. I think a lot of people think having implants is really expensive, and they don't know how affordable it really is.
Yeah. And that's very key, because it's less expensive than the conventional, and the fact that you work with the patient with care credit and other options, now it becomes affordable.
Absolutely.
So you just mainframe it into your life like you would anything else.
Yes.
And that confidence level, I'm telling you, I've had dental work done. I'm not afraid to admit that, because why not? You know, but you sit back and you smile more. I take many more selfies, Doc, than I used to, that's for sure. This is an example of what's called a fixed on 6, and show our viewers again why the mini dental implant makes that a special presentation.
Well, if I can get it off here,
see, it's
they
very
stay
sturdy,
on so well. Yeah. Well, the fixed on 6, we usually use 6 or 8 implants, and we have those housings just like the denture, only this is in a full arch bridge made out of a very strong material. And it stays in. The only time it comes out is when you come see us in the dental office. We take it off and make sure everything's clean, make sure the O-rings are in good shape, and it's back in for 6 months after that.
So if somebody has a denture, they could take a look at this as an option, as sort of step up, if you will.
Absolutely.
And what's nice about that is there's less plastic, because it's just really the porcelain.
Yeah, there's really no plastic. It's all just porcelain teeth.
And as we talked about, you have your baby teeth, your adult teeth, and now Dr. Davis from Greenery Park Dentistry is going to give us our third set.
Well, the third set we call a roundhouse bridge. And in this case, we put 10 or 12 implants in on top or bottom, And the bridge goes in over those implants with cement. So that is permanently cemented into place. So that is like having natural teeth again.
Yeah, and so the ultimate level of confidence there because it's in. But they should go to see you or a dentist to make sure they get their care and checkup.
They need to be checked on a regular basis and cleaned.
And then, as we talked about, a single tooth, you're out hiking, you knock a tooth out, a sports injury, or just some issue with your teeth, a single tooth and the side teeth become very important, and the mini dental implant will make it work.
Absolutely. You have an accident, knock your front tooth out, we can go in and put an implant in there, give you a tooth that's just like the one you had.
Look at that. Take that off again because it's almost unbelievable. There it is.
It is.
And within one office visit,
you have
a new
back.
tooth.
Yes, absolutely.
No more flippers. I remember the flippers there.
The flippers are terrible.
They're done.
Yeah.
And then the side teeth are important because you want to chew your food well, and you should not give up on the back of your teeth. If you have a problem in the back, don't ignore it.
Well, if you're missing these teeth and you don't replace them, what happens many times is the other teeth start shifting around. They don't fit together right anymore. Things start breaking.
And you don't talk right either.
Absolutely. And you can't eat well, and eating well is important to good longevity.
Yeah, very important. Dr. Davis, here's your address. I have one more question for you because I know it's an important one and it's hopefully going to inspire us. But you're at the Greenery Park Dentistry, a mini dental implant center of America, 44-mile drive, Suite 6, Kalispell, Montana, greeneryparkdentistry.com. But we talked about the pain. Talk to the viewer about how little pain there really is with the mini dental implant.
There's a little bit of discomfort. Most people take ibuprofen and they're fine. And the next day they feel pretty darn good. It is very little discomfort involved.
Yeah, and that's important to note because these are over-the-counter medications.
Yes.
Yeah, I mean, they certainly will do the job, but really you don't need anything stronger than that.
No, the over-the-counter medications work great for this procedure.
Yeah, and I know that even looking at some of the cases that you've done, people will say that they almost felt like, really? That's almost too good to be true.
Yes, that's what we hear all the time.
Yeah. What inspired you to be a dentist? And I know you have a special ring on today, too.
Oh, well, I was inspired to be a dentist when I was a young person having dental work done, having my orthodontics done. And as I went through my education, I kind of decided I wanted to be a general dentist. And that's what I did. And then I've just continued to learn and evolve as a dentist and done lots of additional training and became interested in many dental implants and found Todd Shatkin. And I'm really inspired by the people I've met there and the people that I have the opportunity to learn from.
And I know you have a special ring on today that maybe our viewers have seen.
I do. Well, this was my dad's.
Yeah.
And my dad would be really happy to be sitting out there watching me today.
Yeah, he's proud of you because you're an innovator in health in all of Montana, and you've inspired me, and you're going to be helping so many other patients. Dr. Ronald Davis, the Mini Dental Implant Center of America, is at the Greenery Park Dentistry, 44-mile drive, Suite 6, Kalispell, Montana. The website is greeneryparkdentistry.com, and the phone number you want to write down, 406-420-3636. The mini dental implant is 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. You can be you again. It's going to change your life. Dr. Davis, thanks for joining us on the program.
Thank you, John. Appreciate it.
And thank you for watching.